set and setting, because I think that's super important in terms of a psychedelic experience. So I really like the light and the lampshade model. So if you imagine that the light bulb is you, it's your core self, it's your spirit, it's your true self. And then the lampshade is basically your ego. And it's going to filter perception, it's going to color emotion, it's going to help determine your behavior. And it basically, you can see in this, is isolates the core self from the larger whole. So we're all walking around with these like lampshades on our lights that are kind of filtering us from other people. And you can have a lampshade that's clear and translucent, like the one in the middle here. You could have a really thick one. So trauma wires the nervous system to protect rather than connect. So if we had a traumatic childhood, we're going to more likely have a big, thick lampshade, and that is going to cause distorted perception through an identity that seeks safety and love, but can't seem to find it. And it causes consistent suffering. Psychedelics can be a way to kind of like loosen up that lampshade or make that lampshade more translucent so that your light shines. And so you can see things clearly. If you've got a dark lampshade around, you can't see things clearly. The default mode network, it's basically like what our mind is running on when it's not doing something else. So it's the resting state network. If right now my default mode network probably is not doing a ton because I'm actively presenting. But if I'm just sitting here and I'm not doing anything, that's kind of where my brain goes. It's the core of who you are, and it's kind of the default center of gravity. And the important thing about the default mode network to know is what our default mode network is going to depend on what our childhood was like. So the ACEs are adverse childhood experiences. Every patient that comes to see us fills out an ACEs score. And that's so we can see like what's happening basically with your default mode network. If your ACEs score is high, you can see here, if you have 4 more ACEs, 14 times the number of suicide attempts, 4.5 times more likely to develop depression, 10 or 11 times the level of IV drug use, 3 times the level of lung disease and smoking, 2 times the level of liver disease. As we study these adverse childhood experiences more and more, we learn more and more that the impact that they have on us. People with 6+ ACEs can die 20 years earlier than those who have none. So it's really a big deal. Childhood trauma disrupts optimal brain wiring. So, and that's because it's back to that ACEs. So from the time really that we start gestating until 11 years, that's kind of the most important time that our default mode network is forming and our constructs of how we see the world. And so if we have a traumatic childhood, our brain wiring is going to get all messed up, and that's going to rule the rest of our life. That's one of the things that psychedelics really at the core are doing, is they're helping to restructure that default mode network so that when we're in a resting state, we go to a good place and not a bad place. So what were your experiences growing up? Were you in a dark swamp with swamp monsters, or was your life like rainbows and unicorns? And if you were in a dark swamp with swamp monsters, that's what your default mode network is going to be like. And if you had lots of rainbows and unicorns, that's what it's going to be like. And we have 3 different main networks in our brain. The central executive network is what I'm using right now to present. The salience network can kind of go between survival or self-care. And the default mode network is kind of like what we're doing when we're not doing anything else. So we kind of want our default mode network to go to a nice place. And because of the fact that childhood trauma is going to disrupt optimal brain wiring, we're going to have this inner critic that's going to tell us that we're unworthy, we're unlovable. We're going to see the glass not only as half empty, but it might be filled with maggots. And the pain and injustice and helplessness keep that default mode network in overdrive. So not only is it sending suboptimal things, it's also in overdrive. So it's telling us all the time we're unworthy, we're unlovable, over and over again. It makes us hyper vigilant, hyper aroused, and hyper ruminating, even at rest. So we could be sitting there on a beach and everything's fine, and we're still going to be feeling all that. So someone taps us and we jump. When we have this disrupted wiring, it's going to cause sleep disorders, because messed up neurocircuitry is going to mess up the HPA axis, which is our stress center, the hypothalamic pituitary adrenal axis. And then psychologic pain is stored in the default mode network as well. So it's just going to make everything harder. The nice thing is, if we have a healthy default mode network, that's going to be related to decreased anxiety, decreased depression, increased tolerance, increased memory, increased self-awareness. So we have the drug and all the different psychedelics that we talk about, that could be the drug. And then there's the setting. So the setting is like, where are you going to take this entheogen? Who are you going to take it with? What's the environment like? What's your support system? And then the set is, what's your physiology like? What's your state? What's your mental health? What's your history with this? What's happening in your life? All that. So if you have an optimal set and setting, you're going to have an optimal experience. The set refers to your mindset, and that can be something that is just kind of back to the default mode network, like, how are you? So if you're extroverted, if you're open, you're more likely to have that type of experience with the psychedelics. If you are more neurotic, you're more likely to have that type of experience. So that's just important to know up front. And I also think when people have high anxiety and then they get a stellate, that helps to balance things, and it helps them to have a more optimal psychedelic experience. And then setting refers to both the physical and the social environment. So with the setting, there's an individual versus ceremony. So I could go and have an ayahuasca experience with just myself and a shaman, or I can do it in a ceremony. And there's pros and cons to both of them. So, when you're in a ceremony, you're going to have whatever's happening around you is going to impact you. And many people will argue that we heal in community and that ceremonies are better. Other people will argue that you're getting impacted by the other people around you. It's hard to stay internal. There are people doing studies on this, comparing the efficacy of ceremonial healing versus individual healing. I think access to nature certainly is helpful for us healing. We evolved in nature rather than doing an ayahuasca ceremony in a basement, for example. Music is super profound in helping our nerves rewire in our brain. And so when they've studied this, and Johns Hopkins has done extensive research on psychedelics, more with psilocybin, I think, than anything else in MDMA. And it turns out that Western classical seems to have the best effect, and it's the most researched. But basically, it's bringing out those theta waves, which are the relaxation waves in the brain. And there are lots of playlists out there. You don't want to come into one of these experiences playing something like heavy metal or violent music that is then going to be accentuated and potentially put you into that swamp animal area. Why not combine the two? So we can have a retreat where we also have medical personnel. So I think that's like back to integrative medicine. We're combining all of the best of, things 5,000 years ago with all of the best of what we have with modern medicine. So with that, we formed Mind Elevation psychedelics retreats, where we actually do the stellates and the ketamine in a beautiful setting. So that's we're trying to push this whole space forward by combining the safety with the benefit of balancing the autonomic nervous system in a community healing setting with the retreat. All right. Manufactured psychedelics and entheogens. The first one we'll talk about is ketamine. So very briefly, or very, simply, ketamine is going to increase Gaba, which is your most chill out neurotransmitter, and it's going to decrease glutamate, which is one of your most excitatory neurotransmitters. When we do it in the office, it's a 40-minute drip for treatment-resistant depression, an 80-minute drip for pain. And the data is over doing 6 drips over 2 to 3 weeks to have a greater long-term effect. So with all of these treatments, what we're basically doing is stimulating nerve growth, making connections to change the way that we see the world, to take away that thick lampshade. So if we just do it once, it's like removing the lampshade, but then 2 weeks later, the lampshade comes back on. So if we want to keep the lampshade off, the data currently is on doing 6 drips in a period of 2 to 3 weeks. I think combining with the stellate makes it even more effective. I personally, for what we're doing in the office, I like IV because I can make the perfect experience for everyone. So no one ever is going too far, and if they do, it's 2 minutes. So I can adjust the drip. If you say, hey, I'd like it higher, I can adjust it. It's higher in 2 minutes. If you say, hey, this is too much, I adjust it and it's lower in 2 minutes, which is very different from, the psilocybin ayahuasca ceremonies, where if you take too little, you kind of take too little. Sometimes they'll offer you more. If you take too much, you're like on a ride for many hours and you can't really get off. So I think ketamine is super smooth, also minimal side effects. So how does it work? So it's basically, and this is where we start to get nerdy and scientific here, but basically it's all about that glutaminergic system, and the NMDA receptors are what are being used here. And when something of note, so glutamate is this excitatory neurotransmitter. So when this is upregulated, pain signals are going to be sent to the brain, anxiety, we're going to just be worked up. And so what it's doing is kind of calming this all down. You can see how this looks here. So ketamine is going to bind to the receptor, and then it's going to block those little sodium ions from going through. And it's basically going to like down regulate our system and make us feel more relaxed. It also, just of note, because people look into this, it also increases brain-derived neurotropic factor, and it also signals the pathways of rapamycin. So both of those are great for cognitive health and longevity as well. Ketamine stimulates nerve growth. It stimulates the growth of both the parasympathetic and sympathetic nerves. And because the stellate block is kind of helping to chill out the sympathetic nerves and helping to improve our parasympathetic nerve growth, in theory, the combination of stellates and ketamine really have the potential to stimulate parasympathetic nerve growth. And it does really seem that people that are doing them synergistically get better results than one versus the other alone. So psychedelics have really gotten supercharged over the last few years with Michael Pollan's book, How to Change Your Mind, and then his Netflix series. We've gotten a lot of folks coming into the office asking about ketamine drips and ketamine treatments after reading the book. So ketamine specifically has been shown to help the default mode network in the right doses. And it's a synthetic derivative of PCP, and it's been used for years as an anesthetic in the hospitals. It can be taken oral, it can be taken snorted, it can be used IV, IM. It's currently FDA off-label for treatment of treatment-resistant depression and pain as well. But I think it's probably, with most of these psychedelics, it would be beneficial for almost anyone to just kind of help basically remove that lampshade and just help you to be your true self. However, in terms of like what's legal, what is hopefully going to be covered by insurance more and more, is for treatment-resistant depression and pain. People usually feel pretty good right after the drip, and it can last several days to weeks. The reason we want to do more drips is to make it last long term. It helps to modulate dopamine, serotonin, and norepinephrine. So those are all neurotransmitters that make us feel good. And then they also bind to our opioid receptors, which is why we have a decrease in pain with ketamine. This is just a little diagram that I'd like to show briefly, just to show how IV versus IM ketamine works. So when we do an injection into your muscle of ketamine, you're going to get this huge spike, and then it's going to come down. Versus IV, it's kind of nice and even. We can also do oral as well, which is going to also be more even, but that kind of depends on your absorption. So in the office, we usually do IV. Obviously, we can't really do IV in a group ceremonial setting, so we use oral for that. And what's it going to feel like? For most people, I would say their first experience with ketamine is kind of like an open mind, open heart, rainbows and unicorns. It's usually pretty nice.